Good morning, friends. I'm Arthur, and welcome to Senior Strength Show. Today, we're tackling one of the most common questions I get from our community. Arthur, my doctor told me to be careful with pain medications as I get older, but I'm confused about what's safe. Should I take Tylenol, Advil, or aspirin? It's a crucial question because the wrong choice can literally be dangerous for seniors. Here's what shocked me. Recent studies show that nearly 60% of seniors are taking over-the-counter pain medications inappropriately, putting themselves at risk for serious side effects, including kidney damage, liver problems, dangerous bleeding, and even heart complications. But here's the good news. When you understand how these medications work differently in aging bodies, you can make smart, safe choices that effectively manage your pain without the risks. I'm joined today by Dr. Linda Martinez, a geriatric pharmacist who specializes in medication safety for older adults. Dr. Martinez, when seniors ask you about pain relief options, what's the most important thing they need to understand?
Arthur, the most crucial concept is that aging changes how our bodies process medications. The same dose of ibuprofen that was safe at 40 can cause kidney problems at 70. The aspirin that helped prevent heart attacks for decades might now increase bleeding risk more than it protects your heart. We have to think differently about pain relief as we age.
Dr. Martinez, let's start with the basics. We're talking about three main categories here: acetaminophen, which is Tylenol, ibuprofen, which includes Advil and Motrin, and aspirin. These work completely differently in our bodies, don't they?
Exactly, Arthur. Acetaminophen works primarily in the brain to reduce pain and fever, but it doesn't reduce inflammation. Ibuprofen and aspirin are both NSAIDs, non-steroidal anti-inflammatory drugs, which work by blocking enzymes that cause pain and inflammation throughout the body, but they also affect other body systems, which is where the age-related safety concerns come in.
So it's not just about what hurts, it's about how these medications interact with aging bodies. Dr. Martinez, let's dive deep into each option, starting with what many consider the safest choice for seniors. Dr. Martinez, why do most medical experts consider acetaminophen the safest pain reliever for older adults?
Acetaminophen doesn't interfere with blood clotting, doesn't affect kidney function the way NSAIDs do, and doesn't cause stomach ulcers, Arthur. For seniors who have high blood pressure, heart disease, kidney problems, or take blood thinners, acetaminophen is usually the safest first choice for pain relief. It's particularly good for arthritis pain, headaches, general body aches, and fever. While it doesn't reduce inflammation like NSAIDs do, it can be very effective for managing chronic pain when used correctly.
But there are risks with acetaminophen too, aren't there?
Absolutely, Arthur. The biggest risk is liver damage, and this risk increases with age. Seniors process acetaminophen more slowly, so it can build up in the system. The dangerous part is that many people don't realize how many medications contain acetaminophen. Prescription pain medications, cold remedies, sleep aids. I've seen seniors accidentally take 6,000 to 8,000 milligrams daily by combining Tylenol with other medications, when the safe limit is 3,000 milligrams per day for seniors. That's lower than the 4,000 milligram limit for younger adults.
What are the warning signs that someone might be taking too much acetaminophen?
Early signs include nausea, loss of appetite, fatigue, or yellowing of the skin or eyes, Arthur. But here's the scary part. By the time these symptoms appear, liver damage may already be significant. That's why prevention through proper dosing is so crucial.
Dr. Martinez, what's the safe way for seniors to use acetaminophen?
Never exceed 3,000 milligrams in 24 hours, Arthur. That's about 6 regular strength tablets, spaced doses at least 4 to 6 hours apart. Most importantly, read every label of every medication you take. prescription and over-the-counter, and add up all the acetaminophen. If you drink alcohol regularly or have liver problems, talk to your doctor about whether acetaminophen is safe for you at all.
What about people who've been taking acetaminophen for years? Should they be concerned?
Long-term use requires monitoring, Arthur. Recent studies show that even appropriate doses of acetaminophen over many years can increase risks of gastrointestinal and cardiovascular problems in seniors. It's not as safe as we once thought for long-term daily use.
Dr. Martinez, let's talk about ibuprofen, brands like Advil and Motrin. Why are these particularly risky for older adults?
NSAIDs like ibuprofen work by blocking enzymes called COX-1 and COX-2, Arthur. Unfortunately, these enzymes also protect the stomach lining, maintain kidney function, and help regulate blood pressure. When we block them, especially in aging bodies, we can cause serious problems. Seniors are at much higher risk for NSAID-related kidney damage, stomach ulcers, dangerous bleeding, heart attacks, and strokes. The American Geriatric Society actually recommends avoiding NSAIDs in most seniors over 65.
What specific problems do NSAIDs cause in aging bodies?
First, kidney problems, Arthur. As we age, our kidneys naturally function less efficiently. NSAIDs can push borderline kidney function into dangerous territory. Second, stomach ulcers and bleeding. Seniors have thinner stomach linings and are more likely to be on blood thinners, making bleeding complications more severe. Third, cardiovascular effects. NSAIDs can raise blood pressure and increase risk of heart attacks and strokes, especially in people who already have heart disease. Fourth, they can interfere with medications like blood pressure drugs and blood thinners.
Are there any situations where NSAIDs might still be appropriate for seniors?
Only when absolutely necessary and under close medical supervision, Arthur. Sometimes, for severe inflammatory conditions like rheumatoid arthritis, the benefits might outweigh the risks, but it requires careful monitoring of kidney function, blood pressure, and stomach protection with other medications.
Topical NSAIDs, creams, and gels, are those safer?
Topical NSAIDs are generally safer than oral forms, Arthur. They provide localized pain relief with much less systemic absorption. For seniors with knee or hand arthritis, topical NSAIDs can be an excellent option. However, they still require caution if you have kidney problems or take blood thinners.
Dr. Martinez, what should seniors do if they've been taking ibuprofen regularly?
Don't stop suddenly if you've been taking them for chronic conditions, Arthur. Work with your doctor to gradually reduce the dose or find alternatives. Get kidney function and blood pressure checked. Look for signs of stomach problems like dark stools, stomach pain, or unusual fatigue.
Dr. Martinez, let's give our listeners a practical guide. What's the safest approach to pain relief for most seniors?
First line should be acetaminophen, Arthur, but respect the 3,000 milligram daily limit and check all medications for hidden acetaminophen. For localized pain, like arthritis, try topical NSAIDs first. Only consider oral NSAIDs for severe inflammation under medical supervision. Don't forget non-medication approaches. Heat, cold, gentle exercise, physical therapy, and stretching can be incredibly effective and have no side effects.
What about combining these medications? Is that ever safe?
You can safely combine acetaminophen with NSAIDs, Arthur, but this should be temporary and under medical guidance. Never combine different NSAIDs, like taking both aspirin and ibuprofen, because this dramatically increases bleeding risk.
What questions should seniors ask their doctors about pain medications?
Essential questions include, given my health conditions and other medications, which pain reliever is safest for me? How much can I safely take and for how long? What symptoms should I watch for? And are there non-medication alternatives I should try first?
Dr. Martinez, what about interactions with other common senior medications?
This is crucial, Arthur. NSAIDs can interfere with blood pressure medications, blood thinners like warfarin, and diabetes medications. Even acetaminophen can interact with blood thinners. Always check with your pharmacist about interactions before starting any new pain medication.
What's your advice for seniors who've been taking the same pain medication for years without problems?
Don't assume it's still safe, Arthur. Aging changes how we process medications, and health conditions change over time. Have an annual medication review with your doctor or pharmacist to ensure everything you're taking is still appropriate and safe.
Dr. Martinez, what warning signs should seniors never ignore when taking any of these pain medications?
For any pain medication, persistent stomach pain, dark or bloody stools, unusual bruising or bleeding, yellowing of skin or eyes, or severe fatigue, Arthur. For NSAIDs specifically, swelling in legs or feet, sudden weight gain, or changes in urination. For acetaminophen, nausea, loss of appetite, or confusion. Most importantly, if you're taking pain medication daily and it's no longer controlling your pain, that's a sign to see your doctor rather than increasing the dose on your own.
What about emergency situations? When should someone call 911?
Call 911 for severe stomach pain with nausea and vomiting, any signs of stroke or heart attack, severe allergic reactions, or significant bleeding that won't stop, Arthur. Also, if someone takes too much acetaminophen, more than 4,000 milligrams in 24 hours, seek emergency care even if they feel fine.
What's the most dangerous mistake you see seniors making with pain medications?
Taking multiple medications containing the same ingredient without realizing it, Arthur. I've seen seniors taking Tylenol, prescription pain medication with acetaminophen, and cold medicine with acetaminophen, unknowingly tripling their dose. Always read labels and ask pharmacists about ingredient overlaps.
Dr. Martinez, what gives you hope about pain management for seniors?
We're getting much better at understanding how to safely manage pain and aging bodies, Arthur. There are more options than ever. Topical medications, different formulations, better physical therapy approaches, and growing awareness among healthcare providers about age-appropriate prescribing.
Dr. Martinez, let's create a practical action plan for our Senior Strength Show community. What should everyone do this week?
First, make a complete list of every medication you take, prescription and over-the-counter, Arthur. Include vitamins and supplements. Note which ones contain acetaminophen, NSAIDs, or aspirin. Add up your daily acetaminophen intake to ensure you're under 3,000 milligrams. Second, schedule a medication review with your doctor or pharmacist. Bring your complete list and ask specifically about pain medication safety given your current health conditions.
What about people who are managing chronic pain? What's their safest approach?
Work with your healthcare team to develop a comprehensive pain management plan, Arthur. This might include appropriate medications, physical therapy, lifestyle changes, and alternative approaches like heat therapy or gentle exercise. The goal is effective pain control with minimal medication risk.
Any final advice for seniors who are worried about managing pain safely?
Don't suffer in silence because you're afraid of medication risks, Arthur. There are safe ways to manage pain at any age. The key is working with knowledgeable healthcare providers who understand how to prescribe safely for seniors.
What's the most important message for our community about pain medication safety?
You're not stuck with pain, and you're not limited to dangerous choices, Arthur. With proper knowledge and medical guidance, you can effectively manage pain while protecting your health. Age doesn't mean you have to choose between pain and safety.
Friends, here's your takeaway from today's episode. Pain relief after 60 requires a different approach than when you were younger. What was safe at 40 might be risky at 70, but that doesn't mean you're out of options. For most seniors, acetaminophen is the safest first choice, but respect the 3,000 milligram daily limit and watch for hidden sources. NSAIDs like ibuprofen should generally be avoided unless absolutely necessary. Aspirin for heart protection should be evaluated individually with your doctor based on your specific risk factors. But remember, medication is just one tool in your pain management toolkit. Physical therapy, gentle exercise, heat and cold therapy, and lifestyle changes can all be incredibly effective without any side effects. Dr. Martinez, thank you for helping our community understand how to manage pain safely as we age.
Thank you, Arthur. Remember, the goal isn't to avoid all medications. It's to use them wisely and safely.
To our Senior Strength Show family, review your pain medications this week. Make that appointment for a medication safety review. Share this episode with anyone who needs to understand these important safety differences. Hit that subscribe button and ring the notification bell because next week we're diving into natural pain relief strategies that work specifically for seniors. Until then, this is Senior Strength Show, where we help you stay strong and safe at every age.